Good evening, everyone. Today I have selected a topic that will be helpful to you to understand the corneal diseases better. That is nothing, that is the anatomy of cornea. So, let us start with the anatomy of cornea. When you go to the corneal anatomy, you know that cornea is a transparent structure. It is avascular and it is a watch glass like structure. It has to be transparent, otherwise, you will not be able to see this world clearer now. And also, it is avascular. If the blood supply will go in the cornea, it will not remain transparent, and it forms the anterior one-sixth of our outer fibrous coat of the eyeball. It is a watch glass like structure, not a complete sphere. You have seen the watch glasses in your chemistry labs. They are not a complete sphere. The periphery of the watch glasses are flatter. That is our cornea. It is flat in the periphery as compared to the center. When we talk about some dimensions of cornea, the cornea has an anterior surface and a posterior surface. The posterior surface is a sphere of diameter 11.5 millimeter, but the anterior surface is not a complete sphere. It is elliptical. The horizontal diameter of anterior surface is more than the vertical diameter. Like you can remember, like 11.7 and 11. Horizontal is more than vertical. And next is the corneal thickness, that actually is of very much clinical significance. And the corneal thickness increase as we go from the corneal center towards the periphery. In the center, the thickness is around zero point 0.5 to zero point 0.6 millimeter, that is 500 to 600 micrometer, and we move towards the periphery, it increased to 1 to 1.2 millimeter. And basically, next we have to go to the histology. Before that, what is the refractive index of cornea? Around 1.37. And what is the dioptric power? It is around 3/4 of the total power of eye. Total power is around 60, it is around 45 diopters. And histologically, the cornea is made up of 5 layers. You can remember like A, B, C, D, and E. What is A, B, C, D, E? Anterior-most epithelium, then Bowman's membrane, then C, corneal stroma, then Descemet membrane, and then corneal endothelium. Recently, a new layer is discovered which is actually above the Descemet membrane, recently discovered by Harminder Dua in 2013, and that is also called as the pre-Descemet layer. Now, let us move on to the each layer one by one. First, we will talk about the corneal epithelium. Corneal epithelium is made up of three types of cells: the basal cells, the wing-shaped cells, and the flat cells, which are the superficial cells. They are two layered. Then wing cells are 3 to 5 layered, and the basal cells are actually the columnar cells. What about the limbal epithelium? The limbal epithelium is actually the basal epithelial cells of the limbus are actually the stem cells. They amplify, they proliferate into the corneal epithelium. So they will help in the corneal epithelium regeneration, the basal cells. Next, we will move on to the next layer of cornea, that is the Bowman's layer. Bowman's layer is only a condensed superficial part of the corneal stroma, and it has collagen fibrils. It is acellular, no cells are there, only collagen fibrils are there. And once importance of it is, once Bowman's layer is destroyed, it will not regenerate. Now let us move on to the corneal stroma, which is also called as substantia propria. It constitutes the 90% of the corneal thickness. If 90% is this, 10% are rest of the layer. This is the importance of corneal stroma. It is the maximum thickness of the corneas of stroma. Stroma has what? Stroma is made up of collagens, stroma has proteoglycans, and stroma has some cells, keratocytes. Collagen fibrils are type 1, 5, 6. What is the importance of collagen fibrils? They are responsible for the corneal transparency. They are arranged in a parallel stacked manner. One collagen fibril is at 90 degree to another, and they are separated by less than wavelength of light, which is actually responsible for the corneal transparency. Then cornea has proteoglycans like keratin sulfate, chondroitin sulfate, keratocytes which are modified fibroblasts, and macrophages, histiocytes, and few leukocytes. Duat layer, I've already told you about that layer. It is also acellular. It is very strong, impervious to air. What is the importance of Descemet membrane? It is very resistant to chemical agents, trauma, or any pathological process. That is why descematocele. When the cornea is going to perforate, the Descemet membrane is actually that layer of cornea which is actually preventing the corneal perforation. It will protrude out and it will prevent the corneal perforation. That is actually what is descematocele. This is descematocele. And what is Descemet membrane? It is basically the basement membrane of the corneal endothelium. It is also made up of collagen and glycoproteins, and it can regenerate. In the periphery, this layer ends at the anterior limit of the trabecular meshwork, that is, it will form the Schwalbe's line. What about the corneal endothelium? When you talk about the corneal endothelium, it is metabolically most active layer of the corneal endothelium. At birth, the cells are around 5500 cells per mm² at birth, but they will decrease. At young age, there are around 3000 cells, 3500, 3000, 3500 cells per mm², and the number will decrease with age. And the cells are actually hexagonal in shape, and they show a characteristic phenomena. What is pleomorphism and polymegathism? And also the endothelial cells are responsible for the corneal transparency. A sodium potassium ATPase pump is in the corneal endothelium, which is actually pumping out the water out of the cornea, hence responsible for the corneal transparency. What is corneal decompensation? When the endothelial cell count decreases to less than 75%, we call this cornea as decompensated. Now, what is the blood supply of cornea? Cornea is avascular, I have already told you. And what is the nerve supply? Nerve supply of cornea is by the fifth nerve, that is the trigeminal nerve. It will give a branch that is the ophthalmic. Ophthalmic will in turn will give nasociliary, and nasociliary will give long ciliary. And this long ciliary will move towards the cornea through the suprachoroidal space. It will demyelinate, because if the myelination will remain in that nerve, how the cornea will be transparent? So it is demyelinating after entering into the cornea, and then it will form the plexuses in the cornea. It will form the plexus in the corneal stroma, that is intrastromal plexus, below the epithelium, subepithelial plexus, and inside the epithelium, that is intraepithelium plexus. This is the reason for so much pain. If any, even a minor corneal abrasion is causing so much pain because of this intense nerve supply in the cornea, and the lesions are not healing so rapidly because there is no blood supply there. So this is the reason why corneal diseases are so painful. That is all, and the basic points you have to remember, you should remember about corneal anatomy. And I think this video will be helpful to you, and thank you for your patient listening.